Do you have
All right, so I'm streaming.
You're streaming? Okay.
Yep, I'm clicking record. Hold on.
Okay.
All right, so before you start saying, let me just make sure we got attendance. Like I said, we spoke prior to the recording. You do have a quorum, so it's Sandy, the chair, is in person. Pat Cambry, the co-chair, is in person. David Levitt is on his way, and then Joanne Rubino is in person. So obviously that's a quorum. So
Okay.
go ahead, Sandy.
It's 7:05.
Good evening, everyone. It's 7:05 on January 13th, 2026, and this is the meeting of the Health and Social Services Committee. I'm Sandra Unger.
Joanne Rubino, member.
Pat Cambria, co-chair.
We are waiting for the speaker to come and present, but in the meantime,
I can read the
Joanne will read the conduct statement.
Okey doke. Community Board 11 meetings must be held in a professional and hostile-free environment. The following rules of conduct are applicable to members of the public. Community Board 11 and Community Board 11 staff. Here it is. Any action or behavior that disrupts or interferes with Community Board 11 business will not be tolerated during any Community Board 11 meeting and may result in the individual being individuals being asked to leave. If the action or behavior continues, this may be considered disturbing the peace and the appropriate authorities may be summoned. If the meeting is held remotely, the person may be muted or expelled for the remainder. Repeated violations by the same person or group of people may result in further action by the community board. There is more. All public speakers must address the full board or the committee with their concerns. Electioneering for a position other than the officer of Community Board 11 is prohibited. Engaging in acts of violence, including threats, are grounds for immediate suspension of the right to attend meetings pending review by the Ethics and Disciplinary Committee. Respect the equality, diversity, and privacy of all people by respecting and valuing differences of culture and opinion. Refrain from unpleasant or disparaging remarks and other actions. Abstain from all forms of harassment by actively discouraging it. Disseminating false information is prohibited.
Good evening, everyone. I'm still waiting for the Reverend Dr. Thomas Ryer to come and speak. So in the meantime, what I think I'll do is go over some old business before so that we will start the meeting. And I texted him and hopefully he'll get back to me. The meeting minutes from last month have been posted because they are now transcribed by WebEx, I guess. All right. There are no motions, but the old business, I would still like to talk about the health fair.
Okay.
I'm having trouble getting people answering me back about the availability of places. I've gotten in contact with someone from Holy Rosary Church and also from the new CEO, I guess is what you would call him, at Bronx House. I sent them the information they requested and I have not heard back. So I don't know what to do. Any suggestions?
Well, I think it's early in the year. It's only January, so perhaps just be
Yeah, but we have to
persistent.
set a date. I gave them April.
You don't have a date yet.
No, I gave them dates in April and May so that they had a chance to choose. And this time I chose a Saturday because I think last year we said Sunday wasn't always
Sunday is a hard day, but
It's a harder day.
Did you get in touch with Kings Harbor? You know, that meeting room where
No, I haven't.
the yeah, maybe that meeting room downstairs at Kings Harbor, and they have a parking lot, so it would be nice. But I don't know any connections there.
I keep.
But Rita, maybe you could ask Rita.
I've asked Rita.
Oh, yeah, it's like the Allenton Avenue thing there.
That maybe someone who is like the board chair or the district manager should set up a meeting first, maybe because they
Yeah,
have.
Cynthia's
So
on.
I do, what do you
Cynthia's
think,
right here.
Cynthia? I see you're on.
Sandy, if you send me an email, I'll flag it so that we can work on that.
Good, yeah, I know that I've asked Jeremy to look in, but yeah, I'll send it to you again.
With the dates and everything.
You know, I'm thinking if we can't get April or May, that maybe we put it off till the fall. And give us more time. Because I have 2 graduations coming up, and we don't know when they're going to do.
Yeah, that
It's
was.
gonna be hard, what?
I know that we're involved with the Columbus.
Right, and then I have some.
Depend,
Yeah,
it would depend though,
If we have the date,
in September, that
yeah,
would be a.
no, that's not a
Right, so as
problem.
long as we have a date,
Yeah,
so maybe we'll even try for the fall. All right, thank you, Cynthia. So that was the old business. Does anyone have any new business? Well, I'll let you know that next month,
I'll get it.
or you can just,
I'm supposed to have someone from Jacoby Hospital who will give a demonstration or presentation on fall preventing.
Hmm.
Or fall prevention, which I would love for people to be in the office, because he did ask me how many people would be present within our confines, which I think is great.
almost like a seminar or a class.
Yeah,
Oh,
yeah.
uh-huh.
So I'm putting it out there now for whomever,
Okay.
you know, is
Danger
interested.
prevention from Jacoby.
Yeah,
Okay, and that would be like at one of our meetings.
yeah, February. It's that's that for February. I had asked him a while ago, and when he answered me back, he said that you know, he says it will, yeah, it will work. I will make sure. And I told him that the presentation will begin, and he said that February would be better for him
Okay,
than January, so I'm putting it out there. And he asked how many people would attend.
well, as long as it's on, online, then.
Yeah, but I think maybe he wanted to demonstrate,
we'll dem-
maybe having people within the confines. I mean, I'm not 100% sure. So that's.
Oh,
it.
hi, David.
Hi, David.
The door's
is unlocked.
It's not locking.
Oh, we gotta turn the thing with the key. I thought I did.
Yes, but
It was locked when I came in.
yes, but now it's not locked. So I have to do it from the outside.
Yeah, it's,
How are you gonna get back in?
I'm gonna just do it from the outside and then let's see what happens.
yeah, she can fix it. All right, well, thank you, David, for coming. We're still waiting. I contacted Dr. Ryer, but
That's, Pat's.
that's
book.
Pat's books.
You're sitting here?
No,
Just, you can
He
just
did
move
move
it
somewhere.
somewhere. Yeah.
All right, so
Sorry
we're
about
still
that.
waiting, and we were talking about the health fair and possibly we were waiting maybe even to the early fall.
Well, it'll be cooler.
True.
Well, yeah, that, I was,
Well, we usually do in April and May. It's usually good.
yeah,
Last year was in June.
Oh, yeah.
was, yeah, yes.
All right, good?
Yeah, we're good.
Okay.
What do I have to do?
I have to go from the outside to unlock it so the piece comes, so that, yeah,
You know,
Every time that you unlock it, you have to do that?
I guess you
I
did.
don't know, I thought
We did, it was locked.
Really?
I know that get in.
yeah, we had to do.
Says?
I don't know, I think you gotta, before you take out the key, I think the key has to be taken out a certain way so that it will reset. All right, but we're still waiting for the doctor,
How
so
long are we gonna wait?
I don't know, maybe
Bill, do you have his number?
I texted him,
We'll call him.
I don't,
Yeah,
You have.
yeah, call him.
I'll see if
You have his number. You text him.
I didn't have a number, I haven't,
Remember what his email, he's not gonna look at his email.
well, let me,
Well, we have people in the gallery, maybe they want to ask us
Yeah,
any
okay.
questions.
I'll look, yeah, go ahead, I'll let you take over.
I just wanted to, yeah, if anybody in the gallery, has any questions or anything about any things that we spoke about, any suggestions that, you would want us to find presenters for, that would be great. just let us know, raise your hand and then we'll click on. No,
What are you looking for, his email?
Yeah, I gotta
Because it
find
could be a phone number.
that. I know,
yeah.
but it was, that's not what I want, let me get. I want to get at this, let me get on. Okay.
Let's
Let's
see if
see,
the number
yeah.
on there. Yep,
Mo-
there he is, mobile. on
Yeah, I
here.
know, but.
Yeah, yeah.
Is that the one?
Yeah,
Cool.
call him. Let's see, he was on his way. Apologize for everyone.
Is he coming on? Is he
Wait.
coming on?
Calling him now. Yeah, he's coming here.
Oh, maybe he's lost.
Well, he asked me for the directions, I gave it to him, and I,
Hi, you've reached Reverend Dr. Thomas Carter, Interfaith Community liaison. Sorry, he is unavailable at this time. Please leave your name, number, time of call, and a brief message. If this is an emergency, please dial 911. Thank you.
this is Sandra Unger from Community Board 11. I'm waiting, or we are waiting at the board for your presentation. It is now 7:16. I have to know if you're going to come or if there was a problem and you cannot come. Please try to get back to me. Thank you.
Okay. All right, sorry about that, folks.
Yeah, sorry, guys.
I'm sorry.
But while people are waiting, I just want to let you guys know that we have these pamphlets. Emergency New York, my emergency plan, hurricane evacuation zone map, and my pet's emergency plan. These are available here at the office. Chock full of information if anybody is interested. So you can come and pick it up.
Does anyone have any suggestions on what they might like to have us present at any of our meetings?
They're all muted, so.
Oh,
They
So-
can unmute.
so unmute,
But I think they raised it, they're supposed to raise their hand.
raise your hand if you want to say something
I couldn't mute them. Hold on.
and unmute yourself. Oh,
Oh, yeah, they unmute themselves.
Right.
Yeah.
and you could unmute yourself and speak up.
Hi, everyone. Can you hear me okay?
Yes.
Yes, who are we speaking?
Jeanette Abrahamson,
Hi, how are you?
doing well. So this is my first time coming to a CB11 committee meeting, but since it seems like you guys have time to chat, or openly, can you tell me just one of the bigger accomplishments that you guys worked on last year, since this is my first time, dropping in?
Well, besides having presenters come from various organizations and describing what they do for the community, we also had a health fair, which we're hoping to have again sometime this year. And we have people from various organizations and, there for the people to stop at their tables and talk and get information from.
And, like some of the topics, screenings, cancer awareness, domestic violence, a lot of like good topics
And
that,
then, so we said next month we're going to have someone have a presentation on fall prevention.
right.
What
Fall
happens?
prevention for like seniors.
Senior.
Yeah,
and
yes.
Got it. Okay.
And that would be an in-person?
And he will be in person.
Yes.
Yeah.
And we would love people to come into the office if they can.
Now, does CB11 have a senior focused committee?
No.
No, not a senior focus committee, that would go under, I guess, social
Health and
services.
social-
Yeah,
social services.
because we have health and social services.
Got it. Okay.
Right. Is there anyone else with any questions or comments while we're waiting? No? I feel badly because I have all the emails from Dr. Royer. And I reminded him, he asked me to remind him at the beginning of the year, because we had spoken in December. I did that. I sent him the address and everything, and
he responded.
and he responded. And
Maybe call him again.
that was,
So Sandy, just quickly while you give them a call, I'm gonna share something.
Sure, go ahead.
Let me see if I can share my screen real quick.
same moment, I'm gonna get it.
This one. Morris Park business, the Morris Park bid posted this flyer. Can you see it?
Yes.
Yeah.
So, the American Italian Cancer Foundation apparently is doing a mammogram bus on Wednesday, January 21st, hosted by New York City Parks Department, Renaqua 1 Bronx River Parkway. So if you can see
Okay.
this, if you can take a screenshot or check it out on our Facebook page. I'm not sure if I posted it to our Instagram, but it's definitely on our Facebook page. So just sharing, it's best if you schedule an appointment for it. It is no cost. So, yeah.
Cynthia, do you want me to read the phone numbers to call to make the appointment in case?
Sure. Hold on. Let me, there it is.
One is 718-430-1830 or 718-430-1825.
So even though they schedule, I wonder if they take walk-ins.
Or that's something you
Yeah.
can ask.
Yeah. That's a good question.
But that, yeah, but, and I have someone who will be talking about services that the Bronx Cancer Center has, all the different
Yeah,
cancer prevention and cancer services that they have for detection, et
that's good.
cetera. They were supposed to be here tonight, but they had to cancel, so they will have a follow-up appointment.
Okay, so this is a new flyer, attention men 40
Prostate
plus
cancer.
for prostate
That's why,
cancer.
yeah, and that's a big one
Yeah.
late.
So
late.
that one is the same, well, no.
Oh, same day, Wednesday, January
Not the
21st,
same time.
11 to 2, Bronx
Uh-huh.
River Parkway.
Huh. That's really
Well,
good.
well, the PSA test is a simple test.
Yeah.
Yeah.
All right, so besides the mammography, if there are men around, then we want to take a prostate.
Yeah.
So it's the
Yes.
same organization.
The same
United
organization.
Cancer Foundation.
Yeah.
Excellent.
All right, any others, Cynthia, that you may have?
I think those are the only ones I've seen recently. Education, affordable housing. Yeah.
Well, we might as well talk about, we had the Live on New York last year.
Yeah,
Do you maybe want to talk about what kind of things they do and if that person was
Jeanette.
delayed or,
Yeah.
yeah, that
yeah,
was an excellent.
yeah, and this time it would be the Reverend Doctor, and
Uh-huh.
people like someone, a religious person, because when I spoke to him at the health fair,
Mhm.
he spoke about, the different religions and how people, say, oh, I can't do this because I'm this
It's for transplantation, organ transplantation.
patient.
And they have a whole system of recruiting people and it's an excellent organization. I'm sorry that they're not here, because they're really great.
And they're also, yes,
They're really good.
And the point is, what he was trying to get across is people sign up for the organ donor, but not every organ or every person that donates their organs will be
accepted,
be
right? Yeah.
accepted. They have
Right.
to really fit, the need, et cetera. And with the religious background, he spoke about how, he deals with those questions. That's what I spoke to him at the
Right.
health fair.
I'm wondering if we can put up some information on Live on New York. Maybe there's something, Cynthia, that you can find about Live on New York? Because that is really.
Yeah, I was actually just on their website. Hold on.
I can give you their phone number.
Let's see.
They're located in
She's-
Long Island
she's
City,
gonna-
but yeah, okay.
Put something
Thank
out.
you,
Okay,
Sarah.
here we go.
Can you see it?
Yes, okay, yes, they have all the names of the people on the board. Okay, honoring and changing lives. Helping.
All right, so the
as well.
people,
So it looks like they do education engagement, advocacy, logistical planning, and management. Shh, Papa, sorry. I actually, for what it's worth, I actually saw a Live on New York vehicle earlier today when I was visiting my dad at the nursing home, right there in Throgs Neck on East Tremont.
Oh, really? Wow.
Yeah.
oh,
Yeah.
So they have mobile units too then?
like, I guess to talk, et cetera. Well, let me give you the phone number for the office, if anyone is interested. The office of Live on New York is at 30-30 47th Avenue on the 9th floor, Long Island City, New York, 11101. And the office phone number is 718-906-3706.
And they also have a 1-800 gift for New York, which is easy to remember
Yeah,
too.
24-hour.
Right.
Yeah, it's online.
The website is www.liveon, the O on is capital I, NY.org.
Right.
And
Okay.
I'm really sorry, but I think we'll only wait another few minutes.
Yeah, that's,
And then we'll call the meeting to end.
Right, but maybe we could talk about the nurses, maybe we know about the nurses strike and what's going on with that. Possibly.
Well, I know that they,
I know that's a in that,
in that,
in a couple of hospitals in New York City.
So someone, FG has raised their hand,
Okay.
okay? Do they have to unmute?
unmute.
Hi. You have to unmute yourself.
FG.
Hi there. A quick question. Is Live on New York present at this meeting?
No,
No,
we're not ready for them.
I'm sorry, what?
We're waiting for them.
Them, and we've tried contacting, and I've done all my homework, I gave them
It's
the.
so hard to hear you, but if just a yes or no, are they is Live on New York present at the meeting?
They're supposed to be coming to present, they're not here. But we did put something on the screen for information, just in case they don't come. If you wanna know more about it, there's a website and a telephone number that was just put on the screen before.
And I did call,
Okay.
and I left a message.
Yeah. Can someone forward me their contact information or just the general information on their website?
I could give the phone number for the office is 718.
You mean the one that's on their website? I mean, you didn't have a direct contact with them?
I have,
Yes, it's his personal phone number, so.
We can't give you his personal number.
Okay,
but the
all right.
office is 718.
That's fine.
Nine-
I could Google that. All right, have a great night. Thank you so much.
Thank you.
Take care now.
Bye-bye.
Bye-bye.
Anyone else? All right, we're gonna,
Well, about the nurses strike. maybe
Yeah,
we can
and,
discuss that
the Just
before we
Home.
end. And, and the Just Home, yeah.
Yeah.
We also deal with, as social services, we deal with homeless, so this is the Just Home Supportive Housing Project. I don't know if you
at
know.
Jacoby.
At Jacoby, we're not sure if that's gonna go through there. They say they're looking for another site, but we're really not sure. It's up to the city council what they wanna do.
And the city council that would have rejected it completely, it would be like a pro forma rejection because it's from one council person to another. Did not go along with Christine Marmorato request. They were, I guess, angry,
Right.
so,
Well, it's controversial. Some people are for it, some people are against it, so,
right.
you know.
Right, okay, you want
Oh,
to?
no, that's it, about the, I don't know much going on. Does anyone know what's going on with the nurses strike?
I always get no.
Or that's,
That's when I don't even try to kill. I just pull all the.
I can only speak from personal experience in a hospital, working with nurses. I know how overwhelmed they are. I know how much work they do. And I don't want to give an opinion, but
I know your type.
I hope the strike is over soon. That's all I can say.
Right,
Right,
but you know, one of the issues was staffing, where they don't have enough staff to cover what they need to do. And some nurses, I think, are asked to cover multiple patients and don't
especially
have.
in the ICU.
Mhm. Yes, and that was one big issue, and it's been years, and I don't think they've solved that problem at all.
no,
And they were bringing up that all the private hospitals are making a lot of money and the
Well,
executives are bringing in millions, but, you know, share the wealth with them
well,
and get the services that they need and the help.
FG, I noticed that your hand is still up. Do you have anything that you wanna say to us?
I don't think she hears us, maybe she.
Hello, FG?
I think we can adjourn.
Okay,
Okay.
all right.
Just
Did
one last quick note, and I'm sure you've all heard it on the news. We've got a ton of flu this year so far. It's really bad. I'm not going to get into whether people are for or against vaccination, but I will say that the recommendation is that people get vaccinated if possible. If not, just wash your hands, cover your mouths, wear a mask if you can. You know,
and
your-
Sanitizer, use the wipes.
But I also heard today, because I work in a school, that between COVID and flu, I was very surprised to hear that COVID is still a thing, but it is.
It is, and
It is,
RSV too is a big thing too,
yes.
right
yes.
now.
So,
Yeah.
anyway, so everybody stay safe.
Yes, everybody stay safe,
Does anybody else have
take
any?
precautions.
Anyway, I want to thank the people that have been waiting
Yes.
to hear the presentation, and I really feel badly. I mean,
We apologize, yes.
I notified him, reminded him, I sent him the address. He was looking forward, and I even called him, and I don't know.
It happens, it happens.
All right.
Yeah.
Well,
Thank you guys for coming in.
okay, thank you.
Good night, everybody.
Good night, everyone.
Good night.
Have-
Oh, we gotta call Jeremy.
Stop the video.
Yeah.
Oh, we didn't say what time it was adjourned.
Well,
Oh, I just put that.
$7:32.
the
Okay,
meeting's adjourned at 7:32.
okay, let's call Jeremy.
Right,
Okay, I'm gonna close down.
I got it.
Yeah. I'll get my glasses.
Can you,
Get out?
Yeah. There's a way, but she has to,
Okay. Leave the meeting.
yeah, Jeremy, the speakers are around here. And we waited at least a half an hour, so